Welcome to Seasonal Immunity's Influence on Wellness. My name is Willis, and I am the founder and owner of Terre Skincare, and I will be presenting the talk today. If you're not familiar with Terre Skincare, the company offers a holistic approach to skin health, providing an extraordinary experience in wellness. Terre Skincare products are pure and simplistic, 100% synthetic-free, gluten-free, vegan, and organic. Terre Skincare is currently in several holistic skincare practices, hospitals, holistic medical clinics, and wellness centers where it has been accepted and approved to address skin conditions related to medical and health concerns. Some of the medical and health concerns that affect skin include hormone imbalances, insulin resistance, digestive disorders, cancer, autoimmune disease, diabetes, and stress. Holistic skincare is the focus for the next chapter in wellness and integrative health, and Terre Skincare is proud to be at the forefront of defining an authentic approach to holistic skin therapies. Dramatic changes in the body and the skin are a result of modern lifestyle. There are many internal and external health conditions that can affect skin function, thus leaving it vulnerable and devitalized. The goal of our educational talk series is to provide information that will help guide people as they strive to feel and be well. Today, I will be presenting information on seasonal immunity's influence on wellness. Did you ever wonder why during certain times of the year we are more prone to colds, digestive disturbances, mental imbalances, allergies, and skin breakouts and rashes? Well, anyone who has taken allergy medication certainly knows that there's a big difference between temporary relief and real healing. Even though a person who's taken allergy medicine may not consciously experience respiratory disturbances, this relief does not mean that a cure or a healing has occurred. What people should understand is that there may be long-lasting negative effects in the frequent or recurrent application of treatments that suppress symptoms. It's really much like suppressing emotions. Such actions tend to push the emotional turmoil deeper, leading the person to explode at some future time. People may be familiar with the problems associated with the suppression of emotions. People are generally not familiar with the possibility that many conventional medical treatments can suppress their physical symptoms, driving the disease deeper into the person. In the talk today, I invite you to consider that symptoms that occur at the turn of each season is a signal that your body is naturally preparing to function optimally as it transitions from one season to the next. Researchers have found that our internal body clocks, known as our circadian rhythm, is in part coordinated by changes in daylight and temperature. Signals from the environment will influence the type and the quantities of cells that make our blood change from winter to summer and back again. Signals from the environment will activate cells to either turn on or off genetic expression in order to help the body as it transitions from one season to the next, thus causing symptoms that are unrelated to illness and more reflective of the body either defending, purifying, supporting, or repairing itself as it adjusts to the transitions of nature. For example, studies conducted at the University of Cambridge show that diverse cell types involved in immune response appear more elevated in colder weather and darker months. Blood viscosity also changes, becoming thicker in the winter as blood vessels descend into fat for protection. This in turn causes blood to hold pathogens, cellular debris, and waste, which causes irritation to the body and the skin, causing inflammation and increasing immune response. The body is also more sedentary in the winter. People are just less active. So the natural detoxification process is diminished, prohibiting the release of these irritants, thus activating cell types involved in immune response. This is another reason why we hold these irritating elements in the body. As temperatures begin to warm in the spring, blood vessels expand, rising from fat, and the movement of blood allows for these pathogens, cellular debris, and waste to be properly detoxified. As your body releases these inflammatory agents, the cell types involved in immune response will lessen. The transition into more sunlight and warmer temperatures cause cell types responsible for detoxification to increase, thus demonstrating symptoms associated with detoxification, such as sweating, mucus discharge, and skin rashes. So during the winter months, we are at greater risk for health conditions related to excess inflammation, such as eczema and psoriasis, rosacea, Stevens-Jones syndrome, red skin syndrome, and acne. If you're not familiar with Stevens-Jones syndrome, also known as SJS, this is a disorder affecting skin and mucosal membrane. It will demonstrate itself as red rashes on the skin, as well as blistering. The condition occurs as a reaction from medications and infections. Red skin syndrome is a modern skin condition that is caused by the overuse or the addiction of topical steroidals. Here are some examples of skin conditions that are at higher risk during the winter months. We see actinic keratosis or pre-skin cancers, folliculitis, which can occur during chemotherapy, rosacea, telangiectasia or cuperose, grade 2 or 3 acne, and when people participate in either skin resurfacing procedures such as laser or chemical peels. So with each transition from one season to the next, your genes will express enzymes which tell the body to defend, detoxify, protect, or renew itself. So in the winter, physical changes would be an increase in immune response. The risk are skin rashes, irritation, and inflammation. In the spring, physical changes would be an increase in cleansing and purifying, thus causing skin breakouts and rashes. In the summer, physical changes is an increase in circulation. The risk can be skin swelling and dilation to blood vessels. In late summer, we see an increase in cellular repair and regeneration, with a risk of dehydration and dryness to the skin. In the fall, there's an increase in detoxification of the body, thus leading to skin breakouts and flakiness. Terre Skincare believes that wellness products and therapies become more effective when they're tailored to each individual season. The goal is to support, tone, and restore the body and skin as it naturally adjusts to the changes in the environment. So in the spring, months being March, April, and May, Terre Skincare's holistic approach would be to support natural skin cleansing. In the summer, June and July, the holistic approach would be to support skin protection. In late summer, months being August and September, the Terre Skincare holistic approach would be to support skin's natural repair. In fall, October, and November, the holistic approach would be to support skin's natural detoxification. And as we discussed earlier, in the winter, December, January, and February, the holistic approach would be to support skin's natural immune response. Terre Skincare has created supportive products and therapies that reduce adverse skin changes related to seasonal immunity. By participating in these programs and using the Terre Skincare seasonal wellness products, You will be able to support the body as it transitions from one season to the next. Nature does not hurry, yet everything is accomplished. Untitled Skincare's holistic approach to skin health focuses on understanding the body's natural biorhythm and thus uses nature to tone, restore, and support its function. I hope you have enjoyed this presentation, and we look forward to having you participate in the next talk. To learn more about Untitled Skincare's seasonal wellness programs and products, please contact our corporate office at 855-271-8400, or you may visit our website at untiltedskincare.com.